Hi, it's your girl Nikki Badmos, aka MC Honorable Olaiwola. Yeah, I have to quickly come and do this so that you will know things about colon cancer. Like we know the young guy that died, that's Panther. Yes, Black Panther. I call him Panther. I just call him Panther. You know, I'm talking about, is it Chadwick Boseman or something? But you know who I'm talking about. Please, it's high time we get ourselves sorted and know our body. First of all, I want to tell everybody on this platform, even if you're going to watch it later, this is the time for you to know your body. Your body is very, very important. You are the best teacher for your body, not the doctor, not the nurses, not the psychologist, not any health professional, but you and you alone. You are the best doctor to your body. That is, you know what is wrong with your body. It's not the doctor that will tell you, oh, this is what is wrong with your body. No, you know what is wrong with your body. So it's high time we start listening and reading up and getting to know certain things about our body. Now, colon cancer, what's colon cancer? It starts from the digestive system. I think the big digestive system. That's where it starts from. Now, how do we get to say, how do we know what is wrong with our body? Now, there are some times in your body you can wake up in the morning. Some people, the first thing they do in the morning is to go to the toilet. They move their bowels, they open their bowels, what we call they poo poo in the morning. Then some they drink water. You know, some things that you do normally that is normal for you to do. Then suddenly you stop doing it. You are that type that wakes up in the morning and go to the toilet to have a poo in the morning. Then all of a sudden you start getting constipated unnecessarily. It's getting out of hand. You have your abdomen. You have abdominal pain. Yeah, you have abdominal pain all the time, feeling that your bowel is not completely empty. A lot of things, my dear. Even a pregnant woman, yeah, that the bowel is is full and has not emptied the bowel, a lot of things can happen to you. Even on a normal day when you're constipated, the way you feel about your constipation, it starts from somewhere. That's why I say you have to know your body. Now, let me give you some symptoms about colon cancer. Your bowel, like I said, your change of habit in your bowel, constipated or you have diarrhea, or inconsistently, you're not consistent with your way of pooing. You just pull randomly, it goes like very soft or it goes like diarrhea or something. We can read it up. But the earlier we start creating awareness about these things, the better for us. Then sometimes you poo and you see blood in your poo, or there is blood stain in your rectal. I'm talking about that, your anus. There is a blood stain there. Sometimes you have gas, or you have pain in your abdomen, or you go to the toilet and your stomach and your bowel, you have not finished poo-pooing. Then one thing is you're always fatigued, you're always tired, you're always weak. Then the biggest one is when you lost weight without going on a diet plan. You just start losing weight, no diet plan, nothing whatsoever. You just start losing weight. You are not consciously losing weight, but you're losing weight without explaining. Someone asks you now, okay, why are you losing weight? Abitex TV, good afternoon, Mama. Good afternoon. I'm just saying that. I'm so sorry for responding late. Good afternoon, and you're welcome. You can share this program as well, because people normally will think colon cancer will start from an old age. That is the normal thing. But for this guy to die at the age of 43, was it 43 or 42? If I'm not mistaken, then we have to be aware of certain things. We have to take care of our body. I'm telling you, we have to take care of our body, because a situation whereby you cannot explain why you are losing weight. Why you are losing weight, you can't explain it. Then, my dear, there is a massive problem. And the thing with I would say blacks, the thing with us is that we don't really, most of us don't really take care of ourselves. I'm telling you, most of us don't take care of ourselves. We just feel that way, or we do self-medication. We are not really bothered. and all we have at the back of our mind is we want to pay bills, we want to pay bills, we want to pay bills. No, no, no. There's more to life than bills. If you drop dead now, the bills will still be there. And guess what? They will cancel that bill, or somebody else will come and pick up that bill. That's one thing I want us to get at the back of our mind. The moment you start having unnecessary abdominal pain, you're constipated, or you have loose stools just like that consistently, or then you have abdominal pain that you cannot explain. Abdominal pain, you cannot pinpoint what is wrong with you. Then you are now having blood in your rectal, as in your anus, there is blood. Then you're losing weight unexplainable. My dear, don't say, oh, it's because I ate that thing. It's because, no, go to see your GP. When you're that person that poo-poos in the morning, and when you poo-poo in the morning like that, you feel relieved, that has been your thing all along, then suddenly it stops. Understand your body. It is only when you understand your body that you can do certain things. It is only when you understand your body that you can run away from certain illness. It's only when you understand your body that you catch the likes of cancer at a very early age, at a very early stage. For example, I've got a friend that suddenly is it left or right breast, started leaking, having discharge. She's not pregnant, she's not having a menses, she's not doing anything. And she came to me and I said, you know what? It's high time. This is now is the time for you to rush to see the doctor, because we want to catch it if it's breast cancer at a very early stage. It gives you more chances. She said, really? I said, yes. She said, no, this thing has been happening to me for some time. I said, I know. Have you been wearing tight clothes? She said, yes. How do you sleep? She sleeps just like me. She sleeps with her face facing down. I said that can be a part of the problem. That can affect your breast. You must have trapped something or something. And I told her to do a breast examination, which she did, and she found out that she has this lump right underneath her nipples. To God be the glory, she went to the doctors, and the doctor said, no, it's not cancer. It's something they call ductal something loma. If does she wants to remove is one of the dots that has been irritated. Maybe she's wearing maybe she's wearing tight bras and stuff like that. Or she now told the doctor she sleeps that way. Doctor said that is a very, very possible reason, but it's not cancer. They had to do full cancer screening for her. That one, assuming that was cancer, she has trapped it on time. She has caught it on time. This is because she understands her body. Women, men, everybody, this is the time for us to start understanding our body, because it's very, very important. The earlier you understand your body, the better. As we grow older, we don't grow younger, we grow older. We might not look our age. Like if I tell some people to guess my age now, they will be telling me some stories I don't understand, except very few people have told my real age. You understand what I mean? But that is not the thing. It's the body, the wear and tear. And I said, what are you going to do? He said, no, I'm not going to do any operation. I'm not going to do this. I've done too many operations, this, that, and they've done that to me. They've done the other one to me. But this time around, I am not going to do any operation. I am just going to leave it. And I said, have you asked the doctor? She said, yes. I've asked the doctor, and the doctor said, oh, it's okay. It's not like it's dangerous or something, but you can do the operation if you want to do the operation. And she said, no. I said, just keep an eye on it. You understand exactly. Your change of bowel on this colon cancer, we have to be aware. You don't have to be old for it to start, because normally on a normal day, you have to be an older person. But Bosman is just 43. You understand what I mean? The guy was just 43 and he died. And that was the fourth stage from what I read. The fourth stage. He beat the first stage, second stage, third stage. He just gave up because maybe something, he just gave up. He couldn't just go ahead with it. May God rest his soul. So this is a point for us where we all have to do what? We all have to start understanding our body as we grow older. And when your child comes to you, anything can happen at any time. It doesn't give you time that this is what is going to happen or that is what is going to happen. No, it can happen at any time. Please, I've got children die from the likes of leukemia, die from certain disease that on a good day you say, how would this child have this kind of thing? No, I've seen children die at that kind of tender age with certain things. So I am begging, understand your body. Once you are that person that goes to toilet all the time, suddenly you become constipated, unexplained constipation. When you cannot explain your constipation, there is a problem. When you cannot explain your weight loss, there is a problem. When you feel that your bowel is never, ever empty, always feeling full, full, full all the time, this is the time for you to go to see your GP. I'm not speaking French. I am not speaking French. It's just that this is what I've read, and I'm one of the cancer champions as well. And this one funny thing is that with colon cancer, you don't experience any symptoms at the beginning. That's the thing. It starts from when you don't experience all these things, but when you don't have all these symptoms, but you understand your body, you know something is happening. Then the time it comes out, that is the stage, depending on the location where this colon cancer is, or depending on the size, where it is in the intestine, or the size of it, the symptoms, when the symptoms appears, it varies. Please, I will crave our indulgence, everybody, crave our indulgence that we go ahead and do a lot of research. And when the symptoms is persistent, you can't explain your weight. You're 60, then all of a sudden you drop to 40, and you cannot explain if you're doing any exercise, unexplainable. Anytime you're having an unexplainable weight loss, please, please, and please see your GP. That's just the thing. And if you ask me what is the cause, all I can say is that from what I've read, it says it begins with healthy cells in the colon develop changes when it mutates. In their DNA, a cell's DNA contains a set of instructions that tells the cells what to do. And we have risk factors. Go and read that bit to know the causes. But the risk factor that increases colon cancer include older people. I said it before, older people. Once they are older than 50, the rate of colon cancer in people younger than 50 has increased, but the doctors aren't sure why. They don't know why. So it is now our responsibility, just like COVID-19 is our responsibility now to take care of ourselves with this COVID-19. We are the one that stop ourselves from catching that COVID-19 now, because the government feels that, okay, they've given us all the tools that we need. So it's our duty now to make sure that we wash our hands, we do all the necessary things, we maintain the 2-meter distance, we don't do hugging, we don't get ourselves crowded, we are very careful with everything we do. That's how colon cancer is now. Because normally it gets diagnosed at an older age, people older than 50, but these days, no. It's on the increase with younger people, younger than 40, but the doctors cannot explain why. They are not God. They are doctors, they are not God. So it's our responsibility to understand our body, what's going on in our body, what's the strange feelings, what is that thing? You never know what you'll find. But when you catch whatsoever it is at an early stage, it goes a very, very long way. And guess what? Another risk factor. African American race have a greater risk of colon cancer than do people of other races. Apart from when you have a personal history of this cancer, you will know that you'll be checking yourself all the time. But this time, when you don't have the personal history, people can still catch it. Inflammatory intestinal condition, that's chronic inflammatory disease of colon, such as this Crohn's disease, inherited syndromes, that's, family history, low fiber. This is another one for our food. Low fiber, high fat food. Colon cancer and rectal cancer may be associated with typical Western diet, which is low in fiber and high in fat and calories. You understand what I'm saying? A sedentary lifestyle, people with diabetics as well. When you are someone that takes alcohol increasingly, please, please, and please, this is one awareness that I've come to create. Now is the time. It is not tomorrow. It is now. Because it's on the increase and nobody can give us the reason why. It's our duty to take care of ourselves. It's our duty to make sure we don't put ourselves out for things that we cannot explain. Once your body, the DNA, the cells will tell you something in your body. It's just that we are so busy in this Western part of the world where we are so busy, we don't even listen. We want to pay the bills. We want to live one particular lifestyle. Lagaja is driving a Lexus Jeep. You want to drive it. This one, the house is looking better. When you can't afford it, you can't afford it. Your health is your wealth. Like I said, your health is your wealth. Please, please, and please, let's be very careful. Let's wake up. It's a skill, this very prominent guy that does not look like he's got anything at all. But look at him, he died. He still made us happy because we were still watching Black and Panther, we're enjoying it and stuff like that. But he was going through stuff. Please, please, and please, now is the time we have to be careful. We have to know what we are doing. We have to understand our body. We have to, anytime we have any strength in our body, stop doing self-diagnosis. If you give yourself self-diagnosis, still go to the doctor. Use your paracetamol, which is you can buy it over the counter. But watch your body. Once it is persistent, please, please, and please endeavor to go see your GP. This is the quick thing I came to bring to you guys. And until I come your way again, my name still remains Nikki Badmus, aka MC Honorable Olaiwola. Keep subscribing to my channel. You'll be seeing loads of this. Keep subscribing to my channel, comment, like it, view the beginning to the end. Share it with other people. You never know who this is responding to or who I'm talking to. Please, it's our duty. We take everything with our hand. Until I come your way again, I still remain your girl, Nikki Badmus, aka MC Honorable Olaiwola. Bye.